Pregnancy-induced hypertension or gestational hypertension is blood pressure greater than 140/90 after 20 weeks of gestation without the presence of protein in the urine. The cause is unknown. Again, it's blood pressure higher than 140/90. It occurs after 20 weeks of gestation. There's no proteinuria, and this leads to gestational hypertension. The risk factors include first pregnancy, mother under 20 years of age, mother over 40 years of age, multiple gestation, history of high blood pressure or kidney disease, obesity, and placental abnormalities.
So some of the nursing interventions for PIH include self-management. It is taking your blood pressure as directed and report to the healthcare provider any increase of your blood pressure. Also, do dipstick tests to your clean catch urine as directed. We also need to assess the baby's activity daily and be sure to keep up with your prenatal schedule so that we keep track of your records and report any headache, dizziness, or blurred vision. Another intervention is activity restriction. It was recommended before that complete or partial bed rest is good for us, but actually it's not because it increases the risk of many diseases such as thrombophlebitis and cardiovascular deconditioning. So right now, after a lot of studies, it is recommended that we do restricted activity. During intrapartum care, it is important that we continuously monitor FHR and uterine contractions of the mother and the baby. Women with preeclampsia, they are to be maintained on bed rest with side rails up in a quiet, darkened environment. Safety is an important nursing intervention. Emergency drugs such as hydralazine, labetalol, nifedipine, magnesium sulfate, calcium gluconate, or calcium chloride should be at the bedside ready, as well as with the oxygen suction equipment. IV and oral fluids shouldn't exceed to 125 mL per hour. Now we'll talk about magnesium sulfate, as it is the drug of choice for preventing and treating seizure activity. It is almost always administered intravenously as a secondary infusion. Magnesium sulfate, if taken excessively, can cause respiratory or cardiac arrest. So it is important that we have calcium gluconate or calcium chloride at the bedside, as these are the antidotes for magnesium sulfate. So giving it excessively can cause much harm. So that's why it is a high alert medication, and we have to continuously monitor the patient getting magnesium sulfate. Thank you.
Dear Charlie, my name is Anna. I was only 7 when I was exposed to the life of having no mother. My parents married at an early age. My mom was 17 and my dad was 19. Due to this, my dad had to work extra harder, and when he graduated college, he found a well-paid job. During her pregnancy with my younger brother, she had been diagnosed with a condition called pregnancy-induced hypertension. My mom is very stubborn. Being grown with a Filipino background, she wouldn't have come to see the doctor if it wasn't the continuous symptoms she felt. At that time, she was already warned by her doctor that being pregnant for the second time will be dangerous for her. Dad discouraged it, but Mom was stubborn. Both of my parents grew up in large family and have wanted to continue this tradition. She always said she wanted me to have plenty of siblings to play and grow up with. I wanted that too, but I didn't realize that gaining a brother would cost me to lose my mother.
Good morning. My name is May, and I'm the doctor for today. Hi, doctor. Hi. How are you today? Mom, how are you feeling? Oh, are you okay?
So good.
Hear that? Okay, so we have the good news that your baby is doing well. The bad news is your blood pressure has been so high, it's considered not normal for a pregnant woman.
Oh.
The normal blood pressure for a pregnant woman is 120/80, and your blood pressure constantly has been 155/95. Also, the result of this 24-hour urine collection has results with proteinuria. This means that you have more than what is normal in your urine. Your lab work also shows that you have thrombocytopenia, which means that you have a low platelets, okay? And having low platelet means your blood clotting factor is poor.
So what happens to me now, doctor? Is my baby going to be okay?
So for now, I need you to have an under close supervision. And as you already know, in your 26 weeks of pregnancy,
I will prescribe you more of antihypertensive medication, and I will give you 2, and you must take them as prescribed, okay? And we're going to need to take your blood pressure thorough every day. If you have a severe headaches, and doesn't go away with the visual disturbances and bleeding anywhere unusual, you have to report it immediately. If you have an abdominal pain and excessive nausea and vomiting, you must also report it also. And make sure your baby feels good, or you can monitor it. At least 3 movements in an hour is reportable. Lastly, you may notice some swelling in your legs, and that's generally common during pregnancy, however, because of your condition, and it might become a problem.
Does that mean I'll be staying here for the rest of my pregnancy?
So normally, I would send you home, but knowing that your husband constantly travels for work, I would suggest to stay here so we can manage and, we monitor you closely for your condition.
This is very overwhelming. But I would rather stay here. I will call my husband to let him know about the proposed plan.
All right, that's it, good, and it's nice to hear about that. But let me know about your decision for now, okay? And I want you to be a partial bed rest with bathroom privileges. As I see if you're tired, I will take the dietitian, but I'm pretty sure you can still have a regular diet with an adequate protein. And make sure to drink lots of water every day, okay?
Yes, doctor. Thank you.
If you don't have any question, I will send a nurse and brief them about the plan so far. Okay?
Months passed and Mom stayed in the hospital. Because Dad was inevitably out of the state, most of the time, I ended up staying with my grandparents. After school, I would get dropped off at the hospital, and I stayed with her as much as I could. As days passed, she became sicker, and I became more worried about my mom.
Mommy, what's wrong?
I have this horrible headache.
You want me to call the nurse, Mommy?
Please, baby.
Okay, I'll call the nurse line. Nurse? My mom needs some help. Hi, what's going on? I'm your nurse for today. She said she has some headache. Oh, okay. Let me check her blood pressure and I'll touch the anesthesia to check how is your baby doing. Okay. Okay, Mommy, how many times did you have your baby moved for 1 hour?
3 to 4, I think. I've stopped counting after this horrible headache. And my vision is also blurring up right now. I have pain on my right upper abdomen, right here.
Okay, so how bad is your headache?
Oh, it's just terrible. I can't concentrate.
Okay. Nurse, she doesn't look good. Is she gonna be okay? Alright, we're checking her vital signs. Her blood pressure is a little bit high. So I'm gonna give her some medications. I'll give her labetalol and some Tylenol for the pain. And let me know if the headache doesn't go away. Should I call my dad? Yeah, you can call your dad. That's a good idea. And I will let the doctor know about her signs and symptoms. But for now, I really need you to stay quiet and stay with your mom, okay? Okay. Alright.
Thank you, nurse.
Hi, Mommy. How are you? How are you feeling now?
A lot better. My headache and pain in my stomach has gone away.
Well, your blood pressure is back to normal, and that's good. I'm monitoring the screen from outside, and the baby looks good.
That's a relief, but I'm very concerned about my skin. I seem to easily bruise, and these headaches are getting more intense.
Oh, really? So is the headache has been more constant lately?
Yes, I've noticed that.
So your headache appears when your blood pressure is really high. So when your blood pressure is high, you might end up having seizures.
Seizures?
Seizures occurs when your blood pressure is high. That's why we're gonna have to be controlling with it with medications and other interventions. And for the bruising, this is the effect of having low platelets. And platelets are in charge for your clotting factors. So when you have low platelets, it affects your bleeding, and the tendency is you will bleed some more. So in some cases, people get rashes and unusual bleeding, but let me know if you experience any of those, okay?
What about the swelling in my legs? They don't look very good.
Let me see. It looks really bad. Okay, so swelling, I advise that, have you worn compression stockings before?
No.
She doesn't like it. Okay, I advise that you wear them, especially when you're sleeping. They're really good with helping with the swelling. And make sure you elevate your feet with pillows. That way the circulation will be improved. So right now your lower extremities are +4 in size. And I will let your doctor know so he can prescribe some medication to get rid of the fluids, okay?
Okay, that sounds good to me.
After 2 months of being in the hospital, my mom gave birth to a healthy baby boy. It was the hardest time of my life. It was hard to accept when we found out about her condition, and it was even harder to accept that even after following medical advice, we still lost her. I felt bad for myself. I felt even worse for my baby brother. The doctor said Mom had developed complications that further prompted her into delivering early. HELLP syndrome is a laboratory diagnosis for severe preeclampsia that involves liver problems. Due to this, she also developed placental abruption, a case where the placenta had detached from the uterus wall. I couldn't understand it before, but now I have come to accept it.
Our family is now stronger than it used to be. Today, I'm a successful nurse, and my brother is now about to start his college. Dad still travels, but he's home more often now. Mom will be proud of that. Although she would never have admitted it, I knew she didn't like that Dad was hardly ever around. Any type of medical condition is hard, and there's no guarantee that treatment will be effective.
At the end of the day, prevention is still the best cure.